I'm glad you said that because I know a lot of people that will say, oh my gosh, it showed so much arthritis, but I don't feel that much, right? And then there's other patients that have kind of minimal and they're in terrible pain. So one size doesn't fit all, right?
Definitely. So we see a lot of patients in our office where you look at the x-rays and you would be surprised how little symptoms these patients have. And then you see other patients with not so much arthritis on the x-ray, but they have a lot of symptoms. I think that's also has to do with the patient's pain tolerance.
Yes.
And their activity level and the demand they put on their joints.
Now, once you have arthritis, no cure for it, right? No.
Well, you know, when we talk about regular wear and tear osteoarthritis, there's no cure for it, but we can manage the symptoms. When we talk about inflammatory arthritis, if the patient is medically managed properly, it can avoid the problems in the joints.
All right, let's see what puts you at risk for arthritis. We have some points to show you on a graphic. Age, which obviously is always number one, and we just talked about that. Gender, really?
Yeah, so females over the age of 80, over the age of 50 have a higher prevalence of osteoarthritis, especially of the knees.
And let me guess why. Menopause? Is it that big word?
Well, I think there's a hormonal component to it, but I think it's yet to be determined exactly why. I think it's more genetics as well. Okay. than just the hormonal issue. Which
was number 3 right there, heredity, of course. If your parents have it, you're more prone to develop it?
Definitely. If you have family members that have had it, close family members, you probably are more prone to have it, especially if they had the arthritis at a younger age, then there's probably a big genetic disposition to it.
How big of a risk factor is weight, doctor?
Well, weight, I mean, it just makes sense. You know, patients that have that are overweight or obese, which is an epidemic in the United States, they put more pressure on the joints, which can lead to earlier joint breakdown.
Injury such as a dramatic maybe accident or something?
Yeah, so another category of arthritis is post-traumatic arthritis. So if you have a fracture of your knee joint that extends into the articular surface, you can have that damage happen at the time of the accident that is irreversible, and that could lead to arthritis later down the road.